If you're experiencing urinary symptoms, discomfort, or concerns related to your prostate, this video is for you. We'll explore the reasons behind prostate enlargement, common symptoms to watch out for, foods to avoid, and most importantly, the best foods to incorporate into your diet, to stop the prostate from enlarging, and potentially even shrink an enlarged prostate. Let's get started on our journey towards prostate health. Understanding enlarged prostate. Before we dive into the foods that can help with an enlarged prostate, it's essential to understand why it happens. The prostate is a walnut-sized gland that surrounds the urethra, the tube responsible for carrying urine from the bladder out of the body. As men age, hormonal changes, particularly an increase in dihydrotestosterone, DHT, can cause the prostate to gradually enlarge, a condition known as benign prostatic hyperplasia, BPH. This enlargement can lead to urinary symptoms, such as frequent urination, weak urine flow, the urge to urinate at night, and the feeling of incomplete bladder emptying. It's important to note that an enlarged prostate is not necessarily cancerous, but it can still impact your quality of life. Recognizing symptoms and seeking medical advice. It's crucial to recognize the symptoms of an enlarged prostate, and seek medical advice if you experience any concerning signs. These may include increased frequency of urination, especially during the night, nocturia, difficulty starting or stopping urination, weak urine flow, dribbling after urination, and the feeling of not fully emptying the bladder. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional for a proper diagnosis and personalized treatment plan. But the good news is that certain foods can help support prostate health and potentially shrink an enlarged prostate.
1. Processed meats. First up, we have processed meats like hot dogs, bacon and sausage. These may be delicious, but they are high in saturated fat and sodium, a double whammy that can contribute to inflammation, a known risk factor for prostate cancer. According to the World Health Organization, WHO, processed meats, including hot dogs, bacon, sausages and canned meats, are classified as Group 1 carcinogens, which means that there is strong evidence that they cause cancer. The WHO's International Agency for Research on Cancer, IARC, concluded that processed meats are carcinogenic to humans based on evidence that they increase the risk of colorectal cancer. The IARC also found that processed meats are probably carcinogenic to humans and cause stomach cancer. There are several reasons why processed meats may be harmful to prostate health. First, they are high in saturated fat, which can increase inflammation. Second, they contain heterocyclic amines or HCAs, which are chemical compounds that are formed when meat is cooked at high temperatures, typically through methods like grilling, frying or broiling. These compounds are considered potentially harmful and are associated with some health risks. HCAs have been linked to an increased risk of prostate cancer. Third, processed meats often contain nitrates and nitrites, which are preservatives that can also be harmful to prostate health. Of all the processed meats, hot dogs are the most harmful to prostate health. Hot dogs are typically made with high-fat ground beef, which is high in saturated fat and HCAs. They're also often high in sodium. If you are concerned about your prostate's health, it is best to avoid processed meats altogether. If you do eat processed meats, choose lean varieties and limit your intake. 2. Red meat. Now let's talk about red meat, such as beef, lamb and pork, which is also high in saturated fat. Additionally, red meat also contains heterocyclic amines, HCAs, which are compounds that are formed when meat is cooked at high temperatures. HCAs have been linked to an increased risk of prostate cancer. According to the American Cancer Society, there is no clear evidence that any one type of red meat is more harmful to prostate health than another. However, some studies have shown that processed meats, such as hot dogs, bacon and sausage, may be more harmful than unprocessed red meats, such as beef, lamb, and pork. Processed meats are typically high in saturated fat and HCAs, which are compounds that have been linked to an increased risk of prostate cancer. Unprocessed red meats are also high in saturated fat, but they do not contain as many HCAs as processed meats. If you are concerned about your prostate's health, it is best to limit your intake of all types of red meat, including processed and unprocessed meats. You can also choose to eat lean cuts of red meat and cook them in healthy ways, such as grilling or baking. 3. High-fat dairy products. High-fat dairy products like whole milk, cheese, and butter might be comforting, but they're high in saturated fat. Saturated fat can increase inflammation, which is a risk factor for prostate cancer, not something your prostate appreciates. Some studies have shown that whole milk may be more harmful than other high-fat dairy products, such as cheese and yogurt. Whole milk is high in saturated fat, which can increase inflammation. Inflammation is a risk factor for prostate cancer. Whole milk also contains insulin-like growth factor 1, or IGF-1, a growth factor that has been linked to an increased risk of prostate cancer. Cheese and yogurt are also high in saturated fat, but they do not contain as much IGF-1 as whole milk. Additionally, cheese and yogurt are often fermented, which can help break down some of the saturated fat. If you are concerned about your prostate's health, it is best to limit your intake of all high-fat dairy products, including whole milk, cheese, and butter. You can also choose to eat low-fat or fat-free dairy products. 4. Sugary drinks. Sugary drinks like soda, juice, and sports drinks might quench your thirst, but they're high in calories and low in nutrients. They can contribute to weight gain, which is a significant risk factor for prostate cancer. Some studies have shown that soda may be more harmful than other sugary drinks, such as juice and sports drinks. Soda in particular packs a 1-2 punch. It is high in calories and sugar, which can contribute to weight gain. Weight gain is a risk factor for prostate cancer. Soda also contains artificial sweeteners, which have been linked to an increased risk of cancer. Juice and sports drinks are also high in sugar, but they do not contain as many artificial sweeteners as soda. However, juice and sports drinks can be high in calories and contribute to weight gain. If you are concerned about your prostate's health, it is best to limit your intake of all sugary drinks, including soda, juice, and sports drinks. You can also choose to drink water, unsweetened tea, or coffee. 5. Alcohol. Last but not least, alcohol. It can increase the risk of prostate cancer, especially in men who drink heavily. Some studies have shown that liquor may be more harmful than other alcoholic drinks, such as beer and wine. Liquor is distilled, which means that it has a higher alcohol content than beer and wine. Alcohol is a toxin that can damage cells and tissues in the body. It is also a carcinogen, which means that it can cause cancer. Beer and wine are also alcoholic drinks, but they have a lower alcohol content than liquor. Additionally, beer and wine contain antioxidants, which can help protect cells from damage. If you are concerned about your prostate health, it is best to limit or avoid your intake of all alcoholic drinks altogether, including liquor, beer, and wine. You can also choose to drink non-alcoholic drinks such as water, unsweetened tea, or coffee.
By reducing these foods, you can better support your prostate health and alleviate some of the symptoms associated with an enlarged prostate. Now, let's focus on the positive and explore the best foods to eat for prostate health. Incorporating these nutrient-rich foods into your diet can help stop the prostate from enlarging, and potentially even shrink an enlarged prostate. Tomatoes and lycopene. First on our list are tomatoes and tomato-based products. Tomatoes and tomato-based products are rich in an antioxidant called lycopene, which has been shown to have protective effects on the prostate. Lycopene may help reduce the growth of prostate cells, and lower the risk of developing prostate cancer. Cooked tomatoes, such as tomato sauce or tomato paste, contain higher levels of lycopene, that are more easily absorbed by the body. Consider incorporating tomato-based dishes into your meals to benefit from this powerful antioxidant. This delicious addition can offer potential support to your prostate. Cruciferous vegetables. Cruciferous vegetables such as broccoli, cauliflower, Brussels sprouts, and kale are packed with nutrients and compounds that can support prostate health. These vegetables contain glucosinolates, which are sulfur-containing compounds that have been associated with a lower risk of developing prostate cancer. Glucosinolates are metabolized into bioactive compounds that have anti-cancer properties. Including these vegetables in your meals, whether steamed, roasted, or in salads, can provide you with a range of essential nutrients while supporting prostate health. Healthy fats and omega-3s. Healthy fats, such as those found in fatty fish like salmon, mackerel, and sardines are excellent sources of omega-3 fatty acids, which have anti-inflammatory properties. Chronic inflammation in the prostate can contribute to the development and progression of prostate diseases, including an enlarged prostate. Omega-3 fatty acids may help reduce inflammation in the prostate, and potentially alleviate urinary symptoms. Nuts, seeds, and avocados are also great sources of healthy fats that can support prostate health. Consider incorporating fatty fish into your diet a few times a week to support prostate health. Plant sterols from seeds. Another group of foods to consider are those rich in plant sterols, such as pumpkin seeds, flax seeds, and chia seeds. Plant sterols have been shown to inhibit the growth of prostate cells, and can help maintain a healthy prostate size. These seeds are also excellent sources of essential fatty acids and fiber, which further support prostate health. Pumpkin seeds, in particular, have been associated with a reduced risk of developing an enlarged prostate, and may help alleviate urinary symptoms. These seeds are easy to incorporate into your daily routine by adding them to smoothies, yogurt, or salads. Sprinkle a tablespoon of these seeds onto your meals, or enjoy them as a snack to benefit from their prostate-supportive properties. Enjoy the benefits of these nutrient-rich seeds for your prostate health. Green tea and stay hydrated. Green tea is not only a delicious and refreshing beverage, but it also offers potential benefits for prostate health. Green tea contains polyphenols and antioxidants that have been associated with a lower risk of prostate problems. Remember to stay hydrated throughout the day by drinking plenty of water, as proper hydration is essential for maintaining optimal urinary function.
1. Berries. Strawberries, blueberries, raspberries and cranberries are packed with powerful antioxidants called anthocyanins. These compounds help reduce free radicals in your body, which decreases kidney damage and reduces inflammation. Cranberries deserve special mention because they're particularly effective at preventing urinary tract infections, a common concern for men with prostate issues. You can enjoy fresh berries as a snack, add them to your breakfast, or even find cranberry supplements at your local pharmacy that come in convenient powder sachets. 2. Apples. The old saying, "An apple a day keeps the doctor away," might be especially true for your prostate. Apples contain a special soluble fiber called pectin that benefits not just your digestive system but your entire body. Studies show that men who consume high-fiber foods like apples experience fewer prostate problems. This is because fiber helps maintain healthy hormone levels. And as you may know, hormone imbalances can significantly impact prostate health. Apples also provide plenty of antioxidants, including vitamin C and polyphenols, which combat oxidative stress and reduce inflammation, addressing both major prostate concerns, enlarged size and inflammation. The vitamin C strengthens your immune system and supports proper collagen formation, while the polyphenols work as natural anti-inflammatory agents. 3. Watermelon. That juicy red color in watermelon comes from lycopene, a powerful compound that acts as a potent antioxidant. Numerous studies have shown that lycopene specifically benefits prostate health and can significantly reduce prostate problems. Beyond its antioxidant properties, watermelon provides excellent hydration with its high water content. Proper hydration is crucial for all bodily functions, especially for maintaining healthy urine flow. When you stay well hydrated, you help reduce prostate swelling and improve urinary symptoms. Plus, the vitamin C in watermelon gives your immune system an added boost while supporting overall prostate function. 4. Pomegranate. Often called a superfruit, pomegranate contains an impressive array of nutrients and antioxidants that benefit your prostate in multiple ways. Its rich content of polyphenols, therapeutic acids, and anthocyanins helps eliminate harmful free radicals from your body. When free radicals accumulate, they cause cellular damage, kidney problems, and increased inflammation. By consuming pomegranate regularly, you're providing your body with natural antioxidants that protect prostate cells and may even help prevent the growth of cancer cells. Many men report reduced urinary frequency after adding pomegranate to their diet, which can significantly improve your quality of life, especially at night. 5. Bananas. Bananas are rich in potassium, an essential mineral that's crucial for numerous bodily functions, including proper muscle contraction, even the muscles in your prostate gland. Research indicates that maintaining optimal potassium levels can help reduce prostate size and improve its function, potentially easing symptoms of benign prostatic hyperplasia. But bananas offer more than just potassium. They also provide vitamin B6, which is vital for proper hormone function. As we've discussed, hormonal balance is critical for prostate health. The fiber in bananas also supports digestive health, which indirectly benefits your prostate by promoting overall well-being. 6. Grapes. Grapes, especially red ones, contain resveratrol, a powerful antioxidant that's been extensively studied for its health benefits. Resveratrol has impressive anti-inflammatory and anti-cancer properties that can help regulate prostate fat production. Excessive prostate fat is associated with benign prostatic hyperplasia and increases your risk of prostate cancer. By incorporating red grapes into your regular diet, you may help reduce these risks. Additionally, grapes contain quercetin, a flavonoid found in both red and white varieties. This compound has excellent anti-inflammatory properties and may improve prostate function while reducing cancer risk. The added benefits of vitamin C, vitamin K, and potassium make grapes a truly valuable addition to your prostate-friendly diet. 7. Avocado. Avocados are unique fruits rich in healthy monounsaturated fats that benefit not only your heart health, but your prostate as well. These fats can help reduce cholesterol levels and blood pressure while supporting overall prostate function. Recent research suggests that avocados may help maintain a healthy prostate size and potentially reduce the risk of prostate cancer. The combination of vitamins C and E in avocados provides additional antioxidant protection specifically beneficial for prostate tissue. Consider adding avocado to your sandwiches, salads, or enjoying it as a nutritious spread to harness these benefits. 8. Tomatoes. Tomatoes are exceptionally rich in lycopene, the same beneficial compound found in watermelon. What's interesting about tomatoes is that cooking them actually increases the availability of lycopene, making cooked tomato products like sauce or paste even more beneficial than raw tomatoes. The lycopene in tomatoes has been specifically linked to prostate health improvements in numerous studies. Additionally, tomatoes provide vitamins, minerals, and fiber that support your immune system, reduce heart disease risk, and maintain cellular health in your prostate. Consider incorporating tomato sauce, soup, or stewed tomatoes into your meals several times a week. The first line of treatment often comes in the form of prescription medications. There are two main types that doctors usually prescribe: alpha blockers and 5-alpha reductase inhibitors, 5-RIs. Alpha blockers. Alpha blockers are medications like tamsulosin that help relax the muscles around your bladder and prostate. This makes it easier to pass urine without actually shrinking the prostate. One of the big advantages of alpha blockers is how quickly they start working. If you're struggling with that frequent need to pee or have a weak urine stream,
These meds can bring relief within just a few days. They're great for immediate symptom management. However, they don't reduce the size of your prostate, so they won't stop the condition from progressing. Also, some common side effects include dizziness and fatigue, which can be frustrating, especially after the first dose. Alpha blockers might also lower your blood pressure, so it's something to keep an eye on if you already deal with that. 5-alpha reductase inhibitors, 5-ARIs. If you're looking for something that targets the actual size of the prostate, your doctor might suggest 5-alpha reductase inhibitors like finasteride or dutasteride. These work by reducing the levels of a hormone called dihydrotestosterone, DHT, which plays a big role in prostate growth. 5-ARIs actually shrink the prostate over time, which can improve urinary symptoms. Studies show that these medications can significantly reduce prostate volume, making it easier to pass urine. They also lower the risk of acute urinary retention, which is when you suddenly can't pee at all, and you may need surgery to fix it. Another interesting benefit is that 5-ARIs can even reduce your risk of prostate cancer, particularly low-risk forms. One large study found that they could lower prostate cancer risk by almost 25%. But like with all meds, there are some downsides. For one, 5-ARIs might make it harder to detect high-grade prostate cancer. This isn't because they cause it, but rather because they lower your PSA levels, prostate-specific antigen, which is what doctors use to screen for prostate cancer. You and your doctor will need to keep this in mind when interpreting test results. Other side effects can include sexual dysfunction, like lower libido and erectile dysfunction, as well as breast tenderness or enlargement. These can affect whether some men stick with the treatment long term. Surgical options. Now, if medications aren't doing enough or your symptoms are severe, you might need to consider surgical options. Transurethral resection of the prostate, TURP. One of the most common surgeries for BPH is transurethral resection of the prostate, TURP. In this procedure, a doctor uses a special instrument called a resectoscope, which is inserted through the urethra. This device allows them to remove the excess prostate tissue that's blocking urine flow. TURP is highly effective at improving urinary flow and reducing symptoms like difficulty starting urination, a weak stream, or frequent nighttime trips to the bathroom. Most men experience significant symptom relief after the procedure. After the surgery, you'll usually stay in the hospital for 1 to 3 days, and a catheter will help drain your urine for a few days. Recovery takes a few weeks, and during that time, you might experience some discomfort and blood in your urine. While TURP is generally safe, it can lead to complications like bleeding, urinary incontinence, and retrograde ejaculation. Retrograde ejaculation is when semen goes into your bladder instead of out through the penis, which can be frustrating for some men but isn't dangerous. Minimally invasive procedures. If you're looking for something less invasive, there are a few minimally invasive procedures that could be a good fit. Laser therapy. Procedures like holmium laser enucleation of the prostate, HOLEP, use laser energy to remove prostate tissue with less bleeding and a quicker recovery time compared to TURP. It's particularly effective for men with larger prostates. Microwave therapy. Another option is transurethral microwave therapy, TUMT, which uses microwave energy to heat and destroy excess prostate tissue. This is done on an outpatient basis, meaning you won't need to stay in the hospital, and it offers symptom relief without major surgery. Prostatic urethral lift, PUL. This newer procedure involves placing small implants to hold the prostate tissue away from the urethra, allowing urine to flow more freely. It's also designed to preserve sexual function, which is a big plus for many men. Surgical options, both traditional and minimally invasive, can offer significant relief, especially for men with more severe symptoms. For those interested in natural approaches, let's talk about herbal supplements and nutritional supplements that some men find helpful. Saw palmetto. This is one of the most popular herbal remedies for prostate health. It comes from the berries of the Serenoa repens plant and has been used for years to help with urinary symptoms related to BPH. Some studies show that it can reduce urinary frequency, improve urine flow, and cut down on nighttime urination. However, results vary from person to person, with some men seeing significant benefits and others not noticing much difference. It's available in capsules or liquid extract, with daily doses typically ranging from 160 mg to 320 mg. Beta-sitosterol. This is a plant sterol found in foods like nuts and seeds. Research shows it can improve urinary symptoms by reducing inflammation and helping with urine flow. Men who take beta-sitosterol often report a better stream and less leftover urine in the bladder after peeing. Dosages typically range from 60 mg to 130 mg per day, and it's often found in Prostate Health supplements. Nutritional supplements. Pijum. This comes from the bark of the African plum tree. It's been used traditionally for urinary health, and studies suggest it might help with symptoms like frequent urination, especially at night, and trouble starting to pee. Pijum supplements are usually taken in doses of 100 mg to 200 mg per day, but it might take a few weeks to start seeing results. Stinging nettle. The root of the stinging nettle plant is another option for managing BPH. Some research indicates that it works well when combined with other supplements like saw palmetto. It's thought to help by reducing inflammation and improving overall urinary function. You can find stinging nettle in capsules, extracts, and teas, with typical dosages ranging from 300 mg to 600 mg per day. While herbal and nutritional supplements might not work for everyone, they can be worth exploring as part of a broader management plan for BPH.